This is Health Matters. I'm Dr. Mark Castellaw. Our program today is about screening for different types of cancers, and my guest today is Dr. Paul Bierman. He's the president of BMG GI Specialist Foundation. Welcome, Dr. Bierman.
Thanks for having me.
All right, what we're talking about are screening procedures that we do to look for cancer. And of course, with you being in gastroenterology, one of the most important tests that I tell my patients when they come in to have their annual exam is make sure you get your screening colonoscopy. Tell us a little bit about the incidence of colon cancer.
Well, unfortunately, colon cancer is very common. It's the second leading cause of cancer, of deaths from cancer. Totally preventable by having a colonoscopy. So we're very much encouraging people to come in and have their screenings done.
Now, that's a great question. People ask all the time, when do you get a colonoscopy? What age and what risk factors would make you get one?
Sure. Well, if you're having no symptoms and you have no family history of colon cancer, the recommendation is to come in at age 50. However, recently they've lowered that to age 45 for blacks and Hispanics.
Now, what about if you have colon cancer in your family? Is there any kind of formula of when they get colon cancer to when you get the test?
Sure. We recommend that if you have a first-degree relative, a mother or father, brother, sister, aunts and uncles with colon cancer, that you should have your colonoscopy done 10 years before they were diagnosed. So for instance, if your mother, God forbid, had colon cancer at age 52, at age 42, you should have your screening colonoscopy.
Now, Dr. Bierman, what are some of the warning signs of colon cancer? Now, the emphasis of today's show is talking about screening, just when you're not really having any symptoms, but it's time, as Dr. Bierman said, to get your colonoscopy at age 50 or whatever. But what if you're not 50 years old and you start having particular symptoms that warrant a colonoscopy? What are those symptoms?
Well, the symptoms that are most common is intermittent rectal bleeding. That's something to be mindful of. It's very easy to sometimes just pass that off as hemorrhoids, and sometimes it is. But if it's persistent and it's been going on for a while, you certainly should be checked. Other things include weight loss, changes in your bowel function. For instance, if you normally had regular bowel movements and that changed, either having too many or too little, that's important to know. Also, any change in the size and shape of your bowel movements.
So if you have any kind of change, blood or any changes in the bowel movement that's consistent, then you need to get it checked out for sure.
Absolutely.
Now, are there any things that people can do to prevent colon cancer?
There are some risk factors that we know definitely increase the chances of getting colon cancer. A big one, of course, is smoking. So if there's any way to stop smoking for many reasons, including colon cancer. Also alcohol consumption, eating a lot of red meat. And certainly it's been shown that a high fiber diet is good for your bowel function. It may even decrease the risk of getting colon cancer.
Now, you mentioned about family history, and I know that's very important when it comes to colon cancer. How does that play into your risk for colon cancer?
Well, if you have a first-degree relative who was 50 years or younger when they developed colon cancer, it triples your risk of getting colon cancer in your lifetime. So it's very important that you get checked if you have a family member with colon cancer.
In the last minute or two that we have, Dr. Bierman, what message would you give our viewers about getting a colonoscopy and not being afraid about getting one?
Right. Well, unfortunately, the most common reason I hear people don't want to have colonoscopy is because they don't know what to expect. They're afraid they'll have discomfort or it won't be a pleasant experience. And I can assure them that 99% of my patients afterwards said, I wish I knew it was this easy. Once you've had a colonoscopy and you realize that you're asleep for the procedure, it's completely painless, it only takes 15 or 20 minutes, then they no longer have that fear. And people used to also be afraid of the prep, that you have to be prepared the day before. But everything has improved so much in the last 5 years.
Well, in summary, Dr. Bierman has shared with us that not to be afraid of colonoscopies, to get it done, because you'd certainly be more afraid of getting cancer. And then lastly is this very interesting information about insurance coverage for screening colonoscopy. So folks, y'all really don't have a reason not to get a colonoscopy if it's indicated for you. So thank you, Dr. Bierman, for being with us today.
My pleasure. Thanks for having me.